Hi, everyone. Thank you for attending this BizChat today featuring Dr. Stembridge, a forensic psychologist. Thank you for joining us, Dr. Stembridge. How are you doing?
I'm doing fine. Thank you for having me.
Yeah, perfect. Thank you for coming and taking the time out of your day to be on this BizChat with us. We appreciate it. So we'll just jump right in and we'll have our first question for you. But students who are on the call, if you have questions for Dr. Stembridge, feel free to put them in the chat box and I'll verbally speak them out so that people can hear the questions on the recording and they'll also hear Dr. Stembridge's answers. Okay? So the first question I have for you is, for those of us that aren't familiar, please explain what a forensic psychologist does and what they are responsible for when it comes to the field of psychology.
Okay, well, first of all, I'd like to thank you for having me here. I always love to speak with students because I typically come away having learned more than I could possibly teach them. So I hope you will feel free to ask questions as we go along. I don't mind being interrupted. And that usually makes it more interesting. And I'll do the best I can to answer your questions based on my experience. So in terms of what's a forensic psychologist, forensic psychology is a subspecialty of general psychology, and it specifically has to do with the interaction between psychology and law enforcement or the legal system. It involves criminal law, and it also involves civil law. Right now, I'm exclusively involved in forensic psychology and criminal law, although I've done civil, well, I still do some civil law, but primarily criminal law. And it involves consulting with various people in the legal profession. It might be I'm often hired by a court to do different kinds of forensic psychological evaluations, like helping the court determine whether a defendant is competent to stand trial, which means that they're really asking, does this person have a mental disorder that prevents them from understanding what's going on in the courtroom, or prevents them from working with their attorney in a rational manner in their defense. Because in this country, we don't really believe it's fair to put people on trial who are so mentally disturbed that they don't know what's going on and they can't even help their attorney in their defense. And so what we do in that case, if we do find them mentally incompetent to stand trial, then they're sent for treatment. They may get medication, they may get counseling, they get classes in what's called competency restoration, which helps them understand the court and how to work with an attorney. And when they're determined to be well enough to come back, then they have to come back to court and still face the charges, but at least now they're mentally competent to understand what's going on. Another type of an evaluation that forensic psychologists frequently provide are evaluations with regard to defendants who are claiming that they are not guilty by reason of insanity. And so we'll be asked to interview the person, and often that involves interviewing collateral witnesses who may know this defendant and can give you further information about their condition. I should say that the difference between mental competence to stand trial and insanity is, in a mental competence to stand trial, you are evaluating how the person is right now. In other words, can they presently participate in their defense? In an insanity evaluation, you are trying to determine what was their state of mind at the time they committed the crime, alleged crime. So it's a different perspective. And basically in an insanity evaluation, what we're required to do is to determine whether the person understood what they were doing at the time of the crime, and whether they understood that it was wrong. And so if a person is so severely mentally ill, it's possible that they were hallucinating or having delusions. It's not unusual that in an insanity case, you have a defendant who was delusional. Maybe he thought, his children were demons from another planet or who knows what, and he harmed them or even killed them. But he didn't really understand that that's what he was doing, and he didn't understand it was wrong. He thought it was good because God was telling him, you need to get rid of these demons. They're, shape shifting in terms of your children, and God knows what they did with your children. So, in that kind of a delusional framework, people can commit crimes. And again, in this country, we don't feel that it's fair to hold a person to the same level of responsibility if they were insane at the time they committed the crime. So we send them, if they're found not guilty by reason of insanity, they certainly don't get to walk. In fact, sometimes they serve a lot more time if they're found not guilty by reason of insanity than if they were just found guilty. Because what happens if they're found not guilty by reason of insanity, they're sent to a state mental hospital where they're treated, and they're not released until the courts, based on the treating psychiatrists and so forth, recommendations, find that they are safe to return to the community. So sometimes people never return. I've been involved in cases where, one case I'm thinking of up here in Nevada County, the fellow was found not guilty by reason of insanity, and that was like 20 years ago. And he's still there and probably won't get out, maybe, who knows, for the rest of his life. But some people do recover, and they can prove to the court that they're no longer insane, therefore they're no longer a danger to a society. And then they're usually released in what's called conditional release. And that is that they're monitored very closely by the local mental health facility. And they're usually in a board and care home where they're and it could be a locked board and care home, or it could be an open one, depending.
Yeah.
So they really have to prove that they're well and they're no longer a danger.
Thank you. Dr. Stembridge, really fast, we did have a student ask in the chat box if you have to go through a clinical psychology doctorate program before entering a forensic psychologist program.
Yes, you do. Most forensic, good question, by the way. Most forensic psychologists have their doctorate or their PhD in clinical psychology, because you use a lot of the same clinical skills in your forensic evaluations. And you need to take additional postdoctoral training in forensic psychology in terms of understanding the law. The main thing that is different about a forensic psychologist is not only do they have to be a clinical psychologist, but they also have to know the law, because you can't do these evaluations if you don't know what legal standards you're trying to discover. For example, like I was talking about the insanity, you have to understand that the legal standard for being insane is one, you didn't understand what you were doing at the time of the crime. And you didn't understand that it was wrong. And so, you have to usually have a clinical PhD in clinical psychology and additional training in the law. And then in California, in order to be an expert witness as a forensic psychology in the courts, you have to have an additional 5 years experience post licensure.
Okay.
Does that answer the question?
Yes, that was good. Thank you so much for that. So then our second question that we had for you is, please share with us a little bit about your career path, along with what led you to pursue a career in forensic psychology.
Okay, well, it's been a long career path. I guess it started in high school. I was not the greatest high school student. I wasn't very academically inclined in those days, but I did take a class in psychology, and I really liked it, and probably one of the few classes I did like and did well in. And so I decided to go to college, and I went to a community college, which was a good choice for me. I don't think I was really ready to take off to a 4-year college. I had too many other things I wanted to do. And so I went to community college, and when they asked me, well, what are you going to major in? I said, oh, psychology. You know, I liked that course I took in high school. So I majored in psychology. And as you know, in community college, you're mostly getting your basic educational requirements. You don't get a lot of courses in your major, but I had a few, and I enjoyed them. And then I decided, well, you know, I'll see if I can get a bachelor's degree. And so I went to a four-year college in San Fernando, and uh, majored in psychology again, and did very well, actually, and I really liked it. And then I was so I went to I said, well, I'll see if I can get my master's degree. So at the same college, I uh, um, started studying for my master's degree, and was able to get that. And at that point, I was kind of fed up with college, and so I went into the Peace Corps for a couple of years and lived in El Salvador, which was an interesting experience, and I think broadened me as a psychologist in terms of cultural issues and so forth. And then before I came back, I was accepted to the PhD program in University of Houston in Texas, of all places. Um, And so I got my PhD and did my internship. And you have to do, to get your PhD, you also have to do at least a year's internship working as a psychologist. And I did that in the Houston Veterans Administration. And then I didn't have any money. I was a poor student. And so I took the first job I could get to get back to California. And that was at Napa State Hospital. And that was not the most fun job I ever had. These were really pretty burned out folks that didn't even hardly speak. And so all my hotshot ideas about I was going to be this great therapist really kind of fizzled there. You really couldn't do much therapy with these very chronically mentally ill, mainly schizophrenics and so forth. So after about 6 months, I got a job in a community mental health center, and I worked there in both the children's and the adult section. I really enjoyed that because it allowed me to do counseling and with, you know, children and adults and couples and so forth. And did that for about 6 years, and then I went into private practice and practiced primarily counseling for about 20 years. And then the last 25 years, this tells you how old I am, I've exclusively practiced forensic psychology. And I initially got into that doing civil law, and that had to do with providing psychological evaluations with regard to parental termination. These were with parents who had abused or, you know, were got totally wiped out on drugs, and so the Children's Protective Services took their children away, and then they would call me in to do an evaluation with them to determine whether they could benefit from reunification or training services to either get off drugs or learn how to be a better parent and so forth. And that involved evaluating the parents and then writing reports, sometimes testifying in court about the reports. And then I had a friend who was an attorney, and he had been a Superior Court judge, and he asked me to do my first criminal case. He had a defendant who he thought had some mental problems, and he wanted me to evaluate him, which I did. And so I started doing that, and I really enjoyed it. I thought it was really challenging and interesting. And so I did that pretty much. I continued to do the civil work and also primarily criminal forensic psychological evaluations. And then I also worked in the state prisons. I worked at California State Prison at Sacramento. It's more commonly called New Folsom because it's right next door to Old Folsom. And it's a level 4 prison, where that means that these are the most dangerous types of prisoners. So it's a high level security there. And these are inmates that have been found to have serious mental health problems like schizophrenia, psychosis, and major depressions with psychotic features, so forth. I primarily evaluated them and provided treatment for them. I continue to do my private practice in forensic psychological psychology on the side. But it was interesting to work with the prisoners, and I've never seen, well, I should say this, in California at least, what happened to all of our mental patients that used to be in state hospitals, they're now in the state prisons or jails. And so that's a primary place where you find mentally ill people because it's easy for them to get in trouble. If they're mentally ill and they're on the streets, they're not able to work, and so they steal or they, do things that are illegal, and they get arrested and put in jail, and they get back out, and it's the same thing, and eventually they can wind up in prison. So you have quite a huge pool of seriously mentally ill people in our prisons and our jails. And so they have a lot of forensic psychologists that work in that environment. Okay. And then I also worked in what's called the parole outpatient clinic. That's with the California Department of Corrections and Rehabilitation. I did that for several years, and that was basically treating inmates that were now on parole but continued to need psychiatric or psychological treatment. And for probably the last 8 years, I've returned to working exclusively in a private practice in forensic psychology. So that's kind of been my career path.
Okay, sounds good. Thank you. While you were sharing with that last question, we did have a few questions that came into the chat. So a few students actually were asking how working with people with severe mental illnesses affects your own mental health and how you deal with that.
Another excellent question. Well, I think you kind of learn how to compartmentalize these things because people with serious mental health problems can be difficult in a number of ways. One, you might really feel sorry for them because, they have these horrible lives where they were physically, sexually abused as kids, sold on the streets for sex slaves, given drugs at young ages. I mean, they just had no breaks, really. And so you've got these really broken human beings. And on top of that, now they have a serious mental illness. So it's really, it pulls out your heartstrings, I think, to work with some of these people. And on the other hand, somebody that's gone through similar abusive backgrounds may not be, as sympathetic, but may be aggressive. And it's not unusual that sometimes, they're very angry people because they've been so mistreated by anybody that they thought they could trust. And then they've been shifted around through foster homes, group homes, CYA, jail, prison, whatever. So they're not the happiest people in the world. And oftentimes they'll take it out on you and, cuss you out and say things to, try to upset you. So you have to develop a fairly thick skin, and you do, in time. And you don't go into it expecting everybody to love you. If you want that, you should stay with counseling because you're much more liked as a therapist than you might be as a forensic psychologist. Although, I don't have that many people that treat me badly, and most of them are, treat me pretty good. And then, the basic thing, and certainly one of the things I learned in life, and particularly in prison, is if you treat people with respect, you'll get it back, 99.9% of the time, even with the worst people in the world. If you treat them as a human being and see their worth and their value, and they recognize that you're not judging them, they'll give it back to you. And so that's an important skill to learn, I think.
Yeah, that's good advice. Thank you for that. We have another question. Are there career paths related to forensic psychology that maybe don't require a PhD? Maybe an assistant position or something along those lines?
Yeah, there are. We have some exciting developments now that are happening in our local jails. It's called jail-based restoration competency programs. I don't know if you've heard of those, but I've been involved in developing some of those. And they typically employ people with master's degrees. They have either in licensed marriage and family therapist or they're licensed clinical social workers, LCSWs or LMFTs. And these are people that, got their 4-year bachelor's degree and then went a further year to get their master's in marriage and family or social work. And then they go to work, but the first year, usually they have to work under the supervision of a more experienced licensed LSCW or LMFT. But they're often hired to work in these competency restoration programs. Typically, those are in jails, and so you'd have to ask yourself the question, do I really want to hang out in jails all that much? They're not always the cleanest places in the world. So they're hiring a lot of people in that. In California, in order to testify in court, you do have to have a PhD. And I would, what a lot of people do these days is they'll get their bachelor's degree and then they'll get into a master's program in psychology or social work or whatever. There's enough programs now where you can either do it online or you can do it, on weekends. There's those programs. And so you can continue to work so you don't have to, starve for And then, so many people, and once they get their master's degree, now they're earning more money. And so then they can afford to go for the PhD. And I would recommend you go all the way if you're going to go. But there are jobs that can be had at the master's level. And also at the bachelor's level, they're hiring people with bachelor's degrees in psychology to do things like in the parole outpatient clinics or in some of the mental health to teach anger management courses and domestic violence courses, and so they can get jobs teaching. And these are typically people that have been through the legal system that you're going to be teaching, and they've been ordered by the court to take these courses because maybe they committed domestic violence or whatever. And also the substance abuse program hire many bachelor's and master's level psychology students to do substance abuse treatment. You have to get, I think it takes about 6 months and you get a certificate in substance abuse treatment. And so that employs a lot of people because we have a lot of folks that need that.
Yeah, that's good advice. Thank you.
Yeah.
Another student asked, was there a time when your emotions got in the way? And if so, how did you deal with it?
Oh boy. Yeah. I don't know which time to pick. That does happen with some frequency. As I was mentioning earlier, sometimes people, you're going to run into people in this business that are pretty angry, and they'll take it out on whoever is around them. And if you're around them, you might catch it. And it's a little hard. I mean, they're very insulting, and they tell you how stupid you are, and how can you possibly help me? Get out of here. I don't want to talk to you. And particularly if you're working in a prison like I did for a while, these are not voluntary patients. These are involuntary patients. They didn't ask to be treated. It's not like out on the street when somebody comes into your office and says, I'm depressed. Can you help me? And, they're really trying to help themselves. Involuntary patients sometimes really resent the intrusion and the questions. And so that's a little difficult to deal with. that. The other thing I think where maybe my emotions were troublesome for a time, one of the things that forensic psychologists do is we testify as we're expert witnesses in court, and it may be testifying about an evaluation we've done, or it may be testifying about an area that we have some expertise in, like, you know, battered women's syndrome or something like that, that the court wants to hear about. And when I first started doing that, I mean, it's a terrifying experience to go into court and you've got this guy in a black robe sitting up above you, looking down with all kinds of power. And then, you know, you're called upon to testify and you have to swear that you're going to tell the truth, the whole truth, you know, nothing but the truth. And then you've got an attorney that's cross-examining you, that his main goal is to try to show that you don't know what you're talking about and that you're some kind of a, you know, kook or something. And so, you know, their job is to basically try to tear you apart and tear your testimony apart. And so initially, when you're subjected to that, it's pretty terrifying. And it's interesting, though, that now that I've done this long enough, it's probably one of my favorite things to do is to testify now. And so it kind of proves the old adage, you know, careful of the things you avoid because you think you might hate them, because it might turn out that those are the very things that you'll love later on.
Yeah.
So, yeah.
Thank you.
Yeah.
We did have another question come through. What is your main perspective when it comes to treatment? And then they also asked if it's biological.
Well, I've always been pretty eclectic, which means that I draw on all of the, you know, various treatment theories, you know, whether it's behavioral or whether it's existential or, you know, psychodynamic. I don't use that too much. Or biological, because, you know, the brain is part of our biology. And so we can't really, you know, separate the mind and the body. And so, yeah, and in fact, it's really important to know your biology, because many illnesses like thyroid or whatever can create psychosis. And if you don't know that and somebody walks in your office and, you know, they're delusional and hallucinating, you go, oh my God, it's psychotic, I better give them a antipsychotic medication, you know. Well, that may be the last thing they need, because maybe they've got, you know, hyperthyroidism, which means their thyroid is producing much more thyroid in the body, and that can make people crazy. And a lot of the other biological, you know, a lot of organs in our body can produce the same thing. So you do have to pay attention to that. It's not just pure psychology, but you've got to have a training and knowledge also in not medicine, but in biology and how the various organs can affect the mind. So yeah, I'm, you know, I don't identify myself as, you know, I'm a behaviorist or, you know, I'm a psychoanalyst or a, you know, an existential whatever. But I draw from all of them, and I also find that it really depends on your patient, your client, because these different approaches work better with different people, and so you really have to be able to kind of psych out your patient and say what's gonna work best for them. For some people, you know, they love to talk, and it works well for them, and they work through their problems and they feel better, and, you know, case solved. And other people, you know, you may have to use hypnosis, or you may have to take a more, you know, assertive stance in the treatment. And so it's good to have all those tools in your pocket, you know, when you're faced with people with different problems and different personalities and different ways of learning and different cultures too. It's, you know, it's well known that, you know, different cultures have different ideas about psychotherapy, about psychology, and so you have to approach them in different ways.
Sounds good. Thank you so much.
Yeah.
Another question that, yeah, we're getting a lot of questions in the chat box, which is really good.
I like that, yeah.
So another one that came in from chat is from Lauren Kelly. She says that I can imagine your role requires quite a bit of paperwork and documentation. how much time is spent interviewing a person on trial versus documenting the conversation and making a recommendation?
Wow, what a great question. You have great students. Excellent question. Yeah, and I should mention that as a forensic psychologist, much of what we do is writing. Um, so if I understand your question, you're asking me, how do we break down our time in terms of an evaluation? Is that correct?
Yeah, how much time is spent like interviewing versus the amount of paperwork that then is tied to that interview?
Okay, great question. Well, the first thing that I do, and most forensic psychologists do when we're assigned a case, either by the courts or an attorney, is we look at that person's police reports. And one of the things you're looking for in the police reports as a psychologist is, was this person saying strange things when they were getting arrested? And most police are pretty good about documenting these things in their police reports these days. That they'll, if the person's saying, I'm FBI, don't touch me, or something kind of strange that, I can't think of anything else, but so we look through the police reports, and that probably takes at least, depending on the length of the case, that takes anywhere from 2 to 3 hours to go through the police reports. The other thing that we do is, if the person is in jail, we always go to the medical department in the jail and look at their medical records. But, I was saying earlier, that there are always possibilities that a biological problem is causing a psychological problem. So I look at their medical records, and if they're being treated with psychiatric medications, I take special note of that. And so that usually takes another half hour, depending on the length of the records. Then I get together with the defendant, and depending on the type of evaluation that I'm doing, if it's a mental competency, I'll usually spend about an hour and a half directly talking with the patient about those issues, getting a history, doing maybe some testing. If I have a question about their intellectual level, I'll do some intelligence testing. And we have also forensic assessment instruments that we use for different things like mental competency or insanity or whatever. And if it's an insanity case, that takes longer. I usually spend 2, 3, maybe 4 hours talking with the person, trying to get a sense of what their mental state was at the time of the crime. It may involve interviewing people that were with them, who knew them, who saw them during the crime. And, I may want to say, what did they seem like? What were they saying? So I'm getting different sources of information. And then I'll usually come home. That's a nice thing about being a forensic psychologist is most of your work is in the courts or jails or attorneys' offices. So I work at home myself. And then I will score all the tests that I've given and interpret them. That may take another hour or so. And then I will sit down to write the report. And depending, again, on the type of evaluation, that writing the report usually takes anywhere from 2 to sometimes 8 hours, just depending on the complexity of it. And I use a Dragon voice recognition. So I put my little headset on and talk in my microphone, and then it types it out, the report, on my computer. So I don't know how much time that is, but yeah, it's a lengthy thing. And I only schedule probably anywhere from 2 to 4 evaluations a week, because much more time is taken in writing the reports. And so you have to have some proficiency in writing, because you want your reports to not only be accurate and objective, but you want them to be interesting so that, people are not falling asleep when they're reading them.
Yeah. Sounds good. Thank you.
Sure.
Another question that we got in chat from a student is, did you ever feel that your job had consumed too much of your personal life?
Yeah, there were times. I think that I felt that way mostly when I was working in the prison I think I worked in the prison for 3 years, but I also had my private practice on the side. So I was a very busy guy, and I had to be at the prison at 5 in the morning. So I had to drive from where I live in Grass Valley all the way to Folsom, which took an hour and a half. So I was getting up at like 3:30 in the morning, getting cleaned up, driving there, and I would work typically till about 6 in the evening and drive an hour and a half back, and then I'd have private stuff I'd have to do. So it was the best decision I ever made was to quit working in the prison. And I should say that, for a forensic psychologist, they do hire a lot of forensic psychologists. It's probably the easiest place to get a job as a forensic psychologist right now. Because it's a pretty negative environment to work in. As I said, these are involuntary patients. They're not people that are, although, once you gain some rapport with these guys and they realize that you are there to help them, they can become pretty good patients, and many of them did. And I used to even, some of them, it's kind of funny, my wife always laughs at this, but inmates typically don't trust correctional officers, and sometimes they have a good reason for that because correctional officers gossip. And in prison, you don't want anybody to know your business because it can get you killed. And so it's a pretty paranoid place to be. And so often some of the patients I had was assigned to didn't want to come into, we had a treatment center where they would come in and you'd talk to them through the glass because this is high security stuff. And but the correctional officers would sometimes hang out right outside the door, listening to what the prisoners were saying, and sometimes they would actually use it against them, or leak information that could be dangerous to this inmate. So often they would ask, can I talk to you out on the yard? And so I would go out on the yard, and sometimes there was a line of guys. It was like, Snoopy's, psychiatric help, 5 cents. And they would wait in line, and then they would come to me. I was at least, 12 feet away, so nobody could overhear our conversation. But they would patiently, these guys are killers and everything. They would patiently wait in line to have their little session out on the yard where the correctional officers couldn't hear anything. So it was really more confidential. But it was kind of funny to see these. These are guys with tattoos all over their faces and arms, and they're always fighting and stabbing each other and getting involved in riots, and here they were patiently waiting for their little session. So it does happen that some of them do appreciate the help that you're providing.
Mm-hmm. Yeah, that's good.
That was rewarding, yeah.
We have another question from a student. What is your process for preparing to be an expert witness?
Do you mean you don't mean the education leading up to it, but just somebody's called me and they want me to be an expert witness? Yeah. Okay, good question. Wow, you guys are great. Well, it depends on the type of evaluation or why I'm being called as an expert witness. If I'm being called to be an expert witness in an area of psychology that I have some expertise in, like battered partners disorder, where they may have a defendant who has beaten his partner, and the partner really, when they get her on the stand to say what he did, sort of declines to talk or minimizes, I probably had it coming, or he just slapped me a little bit, it wasn't too bad. Of course, she's got all kinds of injuries and hospital records, but they might do that because they're afraid, and they know that this person can find them and wreak revenge on them for testifying against them, or they may be still with that person because they're financially unable to support themselves. So they might call me in to talk about that so that the jury can get an idea, why is this witness who said she got beat up, making this sound like, it was just a day in the park, no big deal. So that would be, so, basically I would review the literature and the research on that area, and so that I'm prepared to, give some accurate information to the jury or the judge, depending on whether it's a jury or judge trial. More frequently, when I testify in court, it's because I've done an evaluation. And that's such a good question, because you should never go into court unprepared unless you want to have them make a fool of you, which you don't. So I will usually go over my evaluation and all of my testing, and I will probably spend at least 4 or 5 hours preparing to testify. And the testimony may only be an hour. Sometimes it stretches out to a whole day, depending on the complexity of the case, but so that I know that I'm prepared. And depending on some judges will not let you look at any notes. You have to have it all memorized. And so you really have to prepare. Other judges, don't mind if you check your notes, and if they say, well, what date was that? And you don't remember, you go, let me look, so you really have to know your material if you want to, testify relevantly and successfully. So yeah, it takes, I spend a number of hours preparing before I go into court.
Thank you.
You're welcome.
So for everyone on the call, we have about 15 more minutes scheduled for the BizChat. So if you do have any further questions, please add them to the chat. We do have 2 other questions currently in the chat that I'm going to ask you. So the first one is, outside of talking with the defendant or client, is your work predominantly group work or working alone?
Is there what?
Outside of talking with a client or a defendant, do you typically work alone as a forensic psychologist, or is it more of a group work that you do?
No, it's typically alone. I review the police records. I, review the medical records alone. I talk to the client alone and do the report alone. So yeah, it's a kind of a solitary thing that way. We do try to, get together with other psychologists and other forensic psychologists from time to time, which is helpful, and discuss, common issues or, matters. But yeah, you mostly work alone.
Okay, sounds good. So then the other question that came in the chat is, what is one thing you wish someone would have told you before you entered this field?
Well, I think I would have wished that they would have told me to enter it sooner, sooner than later, because I really enjoy it. It's a very challenging field. It's a young field. It's constantly changing. So you need to keep up with the research and the literature and the new tests that are coming out to assist you in assessing people. And it's just really a very exciting field, not only because of the nature of the work and the kind of people that you're encountering. I mean, you often, the thing is that each case is different. I have never run into one that's the same, because you have a different crime, you have a different person, you have a different personality. Your evaluation is geared toward whatever the legal question is, which is different from time to time. So I guess, yeah, I wish somebody would have said, why don't you go into that sooner? But I think I didn't. And as I talk to other clinical psychologists, the reason they don't is because they're terrified of testifying in court. It's just, ooh, I don't want to be torn apart on the stand. I wouldn't like that, And I didn't like it at first either. I thought, how dare you? I have a PhD. Why are you attacking me?
Yeah.
I was sort of arrogant that way, but I learned to be a little better behaved.
We do have one other question that came through the chat from a student. If you had the chance to go back in time to change something about a case, would you?
Oh my goodness. Sure. I can think of a number of cases. I mean, in this field, one thing that you have to understand is that you could always have done more work on a case. And often attorneys, when you're testifying, they'll attack you. Well, why didn't you do this? Why didn't you do that? And you really just want to look at them and say, you know what? I was only getting paid so much to do this. I wasn't going to devote my life, for, but you do it. You do as much as. Hang on a second.
Sorry.
Sorry, I'm sorry. Yeah, you only have so much time, and it's your ethical duty to do the most thorough and objective and fair evaluation that you can within the time given. But yeah, I probably, if I had my druthers, I could always spend more hours on almost every case. Although, you get diminishing returns after a while. You get the big picture, and then, you can get little facts that might add or might not add. So, yeah.
Okay. Thank you. So then the last question we have from a student here in the chat is, do people ever pretend to be mentally ill for their own benefit? And if so, how do you know if they are not mentally ill?
God, that's another great question. You people should be forensic psychologists, I tell you. Yeah, that's called malingering. And we get a lot of training in malingering. And yes, that does happen. You can imagine, let's say in an insanity case, maybe the defendant thinks, well, if I can convince them that I'm crazy, I'll go to the hospital rather than the prison. And, I'd rather go to the hospital because they treat me nice and the food's better and whatnot, and I won't get stabbed so much. Or if in a mental competency evaluation, a person may have the idea that, if they think I'm crazy, maybe it'll go easier on me or something. Or if you're dealing civil forensic work, it may be a personal injury case, and the person's trying to, if I were called in, it would be because they had a psychological injury, not a physical injury. And they may be trying to exaggerate their symptoms or even make them up. And so we have a number of really good ways to, because we know that that's a common thing that happens. That's why that's a good question. If you're just doing therapy with a person, you take what they say at face value. You don't really question them and say, well, maybe you're exaggerating or making this up. But in forensic psychology, you have to make that differentiation. You can't just go on the client's. Let's say you have a sex offender and he says, I didn't touch that little girl. I'd never do that. I'm not that kind of person, But, the evidence, shows. So you do have to differentiate between truth and malingering. We have a number of good assessment instruments that have been developed over the years. Interestingly enough, many of them were developed by the Canadian correctional facility. And I think that's because they have a different setup in Canada. They give you access to their inmates. In the United States, it's really hard to get access unless you work in a prison. You can't just walk in and say, I'd like to develop a malingering scale and I want to test it on your inmates. Get out of here. We got to do. So anyway, as a result of that, the Canadians have developed some really excellent malingering scales. And we have some that have been developed in the States also, primarily based on what the Canadians have done. And they're pretty accurate. And basically, for example, in terms of trying to determine whether a person is exaggerating a psychotic disorder, we have questions that we can ask that we know genuinely psychotic people would never say, whenever I talk to my attorney, my palms itch like crazy. I mean, any real patient's not going to have that experience, but if you have somebody who's trying to make you think they're crazy, they might go, yeah, that sounds pretty crazy. Yeah, that happens to me. How did you know that? Just mentioning it makes them itch, and they'll, so yeah. And the other thing that we do if the person is in custody, I always talk with the correctional officers because they're the ones that live with these people. They see them day and night, day after day. They know what they're like. They see them interacting with other inmates. And so I always talk with them and say, you know, what's this guy like? And so then if that person presents a real different picture, you know, like acting like they're crazy or something, and I talk to the correctional officers and they go, the guy, you know, he's always playing cards and, you know, he got friends, he works out, I've never seen him act crazy. Then, you know, you have some collateral information to consider. So yeah, that's a really important area. And there's a lot of research in the colleges, and particularly the ones that teach forensic psychology courses that have to do with detecting malingering and lying and exaggeration. And people will fake good, and then they'll also fake bad. So we have instruments that tell us, like the MMPI has scales on it, and so does that's the Minnesota Multiphasic Personality Inventory, and a number of other personality inventories have built-in lie scales that detect, you know, one, is the person paying attention to the questions on the test, or are they just, you know, marking them randomly, or are they, you know, making themselves sound really, really good, better than they are? They're, you know, minimizing their symptoms, or are they exaggerating their symptoms for secondary gain, making themselves sound really bad? So we have good ways of detecting that. Yeah.
Okay.
Great question.
Thank you. So we have one other question. I think we have just a few minutes here for this last question. What is one misconception about forensic psychologists that the general public has?
Another excellent question. Well, I will say from all the TV shows, you know, Criminal Minds, and that we all like to watch on TV. I don't like to watch them too much because it's too much like work. But one of the myths that they seem to promote is this psychological profiling. That's what forensic psychologists do. They do psychological profiling. And the only place that's really done is with the FBI. They have a behavioral analysis unit, and they do that, but it's not very accurate, and it's frequently wrong. And but they still do it, but they don't do it very much anymore because it hasn't proved that useful, which is really disappointing for a lot of people to hear, because, you know, that's what they want to do, is be psychological profilers, you know, and be able to tell the police, well, this guy's a bald-headed guy with a long nose and a goatee, and he limps on the left side, and he's got a tattoo right in the center of his forehead. Go get him, you know. And it doesn't work that well, really. I mean, there is some value in it, because what the psychological profilers do is they study thousands of crimes, and they look for, you know, what's similar, what kind of people typically commit this kind of a crime as opposed to that kind of a crime. So you can come up with some useful information, you know, that, you know, if you're looking for a guy that you think there's been a rape committed and you don't have a lot of information, you know, you might look at the profile information and say, well, you know, what kind of guys commit rape in Chicago and at, you know, 3 a.m, and you know, try to strangle the woman, or don't harm the woman, or threaten her with a knife, and so you can kind of put little pieces of that puzzle together, and so yeah, it does have, psychological profiling can be useful, but it's not, you know, the thing that kind of you see on TV. And I like to watch. Does anybody watch Bull on TV? He's a clinical psychologist.
Oh yes, I've actually seen that one.
Yeah, he does jury consultation, and he's got this mock jury that he hooks up to all this, you know, electronic monitoring equipment, and that doesn't really happen in real life. But forensic psychologists do work as jury consultants, and we consult attorneys in terms of what questions to ask juries, potential jury members, to determine whether they're going to be helpful to their client or not helpful. And so we get hired to do that sometimes. Yeah.
Sounds good. Thank you so much. I appreciate that. So we do have just a few minutes here. I wanted to add in the chat for everyone that survey link I mentioned at the beginning for you as a student to fill out so that we can make sure we do helpful biz chats for you in the future. If you can just take a few minutes as a student and complete that survey, that would be excellent. And then I also wanted to add for you guys who are on the call, the link for Dr. Stembridge's website. He does have a website that lists further information. So if you are interested in checking that out, the link for that website is in the chat as well. And I just want to thank you, Dr. Stembridge, for taking the time to be on this call with us and sharing all the helpful information that you shared about working in forensic psychology. And we just really appreciate it. So thank you so much.
I enjoyed the Thank you.
Sounds good. Okay, thanks everyone. I'm going to end the biz chat now. Have a great rest of your day. Bye. Thank you, Dr. Stembridge.